Watching a patient from possible Ebola in Kansas City. We have live team coverage. We start with Garrett Hake at the University of Kansas Hospital, where the patient is right now. Garrett.
Krista, the patient is a man in his 40s with a home here in KCK. Until last week, he was working as a medic aboard a ship off the western coast of Africa. But when he started to feel unwell himself, he traveled home and today checked himself into the hospital. The patient arrived at the University of Kansas Hospital before 7 this morning. Hospital staff met him in full protective gear, including masks and gowns like these, and immediately whisked him to an isolation unit in the emergency department. There he remains under round-the-clock care and observation tonight.
There's no patients on the unit. There's no patients that can walk in. There's no people that can walk in there inadvertently and expose themselves to any kind of infectious agent.
Doctors and nurses here have trained for months to use protective equipment properly and to watch each other's backs. Teams of 6 will monitor the patient around the clock. More than 50 hospital staffers in total who won't see any other patients until a diagnosis is made.
And I feel very comfortable with how he's being treated and that the necessary safeguards are in place.
The patient had diarrhea, nausea, and vomiting, all Ebola symptoms, but no fever. Dr. Lee Norman, supervising his care, said his condition improved throughout the day.
The gentleman today has done well. He's getting his strength back. The fluid, I think, is helping him.
Dr. Norman said the patient has been too exhausted to speak much, but has given doctors and investigators who will retrace his steps enough information to get started.
We have the information we need to treat him, and we've turned over the information that the public health officials need to do the investigative work.
And Krista, one of the things the patient told doctors that was when he was working as a medic, he treated other people with typhoid. And right now, doctors here consider that a more likely diagnosis than Ebola. But they hope to know for sure tomorrow when those test results come back sometime in the evening. Krista?
Garrett, we were wondering, too, if he had symptoms when he was traveling back to Kansas City.
Yeah, the doctors here today said the man did exhibit some symptoms, including a fever when he was flying back home. But the CDC told us he traveled through Equatorial Guinea, which is not a country that's currently experiencing an Ebola outbreak, which may be why he wasn't picked up by any of those tighter screenings. But that's information we'll continue to get tomorrow after a diagnosis is made and the CDC begins a proper investigation.
All right. Thanks, Garrett. Good information.